This doesn't. Okay. Good evening and welcome to the 31st webinar by the Foreign Correspondents Club of South Asia based in New Delhi. A hearty welcome to all our viewers, both in India and some from across the world. We are very happy to be conducting this webinar, but indeed sad times in India and the world, and particularly India as India grapples with the second very devastating wave of the COVID-19 pandemic. Before moving ahead on this particular webinar, I'm sure that all of you know that this webinar is about journalists on the COVID-19 frontlines in India. I just want, as president of the Foreign Correspondents Club, my name is here on the screen, Mahesh Gupta, and I've just taken over. I want to first take this opportunity to salute the courage and conviction of my fellow journalists to be equally on the front line covering the pandemic in India and elsewhere in the world. In terms of my few cents, I can say that this is a very important and crucial role that journalists are playing in times of crisis like these to provide the correct and accurate information, whether it's good or bad. And most importantly, we must be cognizant of the fact that in these unprecedented times of such a pandemic, we have to keep the people and audience away from any panic, because that makes matters worse. I'm looking forward to hearing all my fellow panelists who are primarily foreign correspondents and Indian correspondents covering the pandemic in India. I'm particularly glad to welcome my colleague, Emily Schmoll from the New York Times, who's a part of the managing committee or the governing committee, as I've learned the name is, of the Foreign Correspondents Club of South Asia. And another colleague member of the Foreign Correspondents Club, Asta Rajwanshi. She is an Indian fellow from the Institute of Current World Affairs and doing a lot of good work in India. Thank you for coming up with this idea. And thank you, the panelists, for joining us. I will now move the mic over to Asta and Emily to take it from here.
Yeah, well, thank you so much, Mahesh, Emily, and the FCC for hosting this event. I wanted to thank everyone for being here. I know it's a particularly difficult time for all of us, so I'm hoping that we can provide a collaborative and supportive space for journalists through this discussion. The idea behind the event was really just to allow journalists to talk about the challenges that they've been facing in their reporting. This has been an ongoing and unprecedented news story for over a year now, and takes a lot of mental resilience, not only to cope with COVID-19, but also to be the person who's putting it in context for everyone else. So we'll be asking our panel, who has been working tirelessly reporting on the pandemic, about the unique challenges that they've been facing. And hopefully we can cover a range of topics, from official data and ground reporting to the barriers of accessing information, as well as talking about the personal challenges of doing this day in, day out. So I just wanted to say, if anyone in the audience has a question, please feel free to post it on the FCC's Facebook page. We would love to have your inputs and insights as well. So yeah, Emily, if you want to say something.
Sure. Thank you so much, Asta. Thank you so much for organizing this very critical event. Thank you to Mahesh for being our fearless leader at the Foreign Correspondents Club of South Asia, and welcome to all of the fellow journalists here and anyone watching from anywhere in the world. Another one of our colleagues here in Delhi, Danish Siddiqui, who's been taking really heartrending images of this catastrophe in Delhi for Reuters, I noticed, said on Twitter recently that, it was not heroics, it was just his duty. And while I agree that this is our duty as journalists to be here now and to witness the horrific things we're witnessing and to synthesize this information and make sense of it for the broader world, I still think it's heroic. And I think it's okay occasionally for us to, take the time to give one another kudos for the very, very difficult work we're doing in a very difficult time to be living through. So with that, Asta, if you want to begin questions for the panelists. Thanks again for being here. Just a reminder that we are live on Facebook, Twitter, and YouTube. And if you'd like to send questions or comments that we can take up, the panelists can take up, please do so through Facebook Live, just on the FCC South Asia Facebook page.
Thanks, Emily. So I just wanted to start by maybe doing a quick introduction to all of our panelists here. I'll start with Suhasini. She's been reporting for the New York Times here, and most recently she co-reported on the discrepancies between official figures and on-the-ground reports of COVID fatalities. We also have Vikas Pandey from the BBC. He's just joined us. Vikas is the India editor, and most recently he was reporting on the black market that was profiting off of this tragedy by selling overpriced medical supplies. He's also been leading the BBC World's in digital coverage across India, so he's been working with a lot of reporters to get that coverage off the ground. We also have Anu Bhuyan here. She's a special correspondent for India Spend, and Anu most recently pored over data to report on how oxygen beds fell drastically at a time as COVID cases increased. Her reporting has often looked at the data that tracks ground claims, whether it's the state's vaccination targets or new variants. And lastly, we have Mahesh Langa here. He's a journalist for The Hindu, and Mahesh has been tirelessly reporting on the ground on the COVID situation in the western state of Gujarat. His last report looked at oxygen shortages in the hospitals in the city of Surat. So I wanted to start with a more personal question, if I may. I just wanted to ask how all of you have been doing. If you don't mind describing how your last few weeks have been, either work-wise or personally, I think we would love to hear that. We can start with you, Suhasini.
More of the same in a more catastrophic way of what we've been seeing and reporting on for the past 1.5 years. I mean, we were not ready for like these numbers that kind of started piling up. Like for the past 3 weeks, the stories changed very fast, and the pace of reporting had to kind of be kept up with that. So, and then the entire family fell sick, from my mother's side. So it was like, a double whammy, because, you got to kind of keep up with the reporting. There's also kind of be trying to do, treatment for your family and at this from this distance. So it's been kind of stressful, but since most of them are recovering and recovering well, it's a kind of hopeful. Basically, I just feel less stressed at this point when I see my family members getting out of it. But the pace of reporting just caught up and caught us unawares in the past 3 weeks versus what we'd been doing for the past 1.5 years. In terms of the way the cases started going up, nobody was ready for this kind of an apocalypse now kind of a situation.
Over to Vikas. Thanks for joining us. Vikas, you might have to unmute yourself, sorry.
Okay, I am. Can you hear me, guys?
Yeah.
Yeah, I can hear you.
Okay, all right. I'll just repeat what Suhasini said. This did catch us completely unaware, and the most difficult part of reporting this second wave has been, the blurring of lines between the personal and the professional. I lost a cousin a few days ago in Gangaram Hospital, probably due to lack of oxygen, but still not clear. A number of family members are still in hospital, some distant and close. Friends, their families, and it's difficult. There have been times when I'm leading the coverage, writing a story, but at the same time we're getting calls from friends and family. If you could arrange a bed, if you could arrange remdesivir, I'm sure everyone will agree is going through the same. So the most difficult part for me has been the blurring of line between the personal and the professional. Most of us have reported really difficult stories, from terror attacks to whatnot, but it's always been a ringside view. But here we are smack in the middle of it, and I don't think so any of us were ready or actually knew how to deal with it. And one thing which I keep telling my team and journalists who are on the ground anywhere in the country, particularly freelance and stringers, that we really need to look after each other, because there will be issues related with PTSD as we go forward.
Thank you so much, Vikas. Yeah, I think one of the reasons we wanted to put this together was to provide a space for journalists to be able to talk about the effects of this kind of reporting. Anu or Mahesh, if one of you want to step in.
Yeah, sure. Mahesh, why don't you go first? Yeah.
Yeah. So, it's very, very stressful in the sense that, in the second wave, we keep getting calls throughout the day and till very late at night that, somebody needs a bed, somebody needs oxygen cylinder, somebody needs, ventilator. If you can arrange some remdesivir injection shots for, a friend's friend or some relative. So it's very, very tiring, mentally very exhausting, phase of life. And then, frankly speaking, we were not, prepared. Even journalists were not prepared that, India will be hit with such a massive, massive wave of the pandemic, So, in last 1 week in Ahmedabad, three journalists, top-ranking journalists have died. So you can imagine the situation that we are operating in.
Yeah, and again, I wanted to express my condolences for everyone who's suffered the loss of COVID here. It's something that hits home for a lot of us. Anu, did you want to tell us about your experience?
Yeah, sure. I've been covering healthcare for a long time, so I think it's a bit disappointing in some ways because as a journalist, you tend to have a close idea of how things are panning out, but also how things may pan out. And so many of the things that I'm having to report on, it feels sad to be reporting on again and again because these are things, systemic issues which the health system should have addressed at some level, which we didn't, and we're probably not going to address it going forward, which is sad. So I reported on the Gorakhpur oxygen shortage a couple of years ago when oxygen ran out in that hospital and those babies died. And at that time, the chief minister of Uttar Pradesh, the same chief minister, he said that was fake news and he wanted to penalize people who were talking about it. And today, he's doing the same thing. He's calling it fake news. So it's not a great place to be as a journalist when history repeats itself and you're aware because you reported on it then and you reported on it now. And I think also, if I was a sports journalist, if I had to cover the Olympics, it would have been perhaps the biggest credential of my career. If I was a foreign correspondent or a diplomatic affairs reporter covering let's say a crisis in the Middle East, would have been a big credential in my career. This is my Olympics as a health reporter, and it's potentially it's something that I will leverage professionally. And I would say, I covered India's great pandemic of 2020 and 2021, but we all want it to stop. We don't want this to keep going. No amount of good journalism will make this kind of a crisis worth it. So it's a terrible place to be, really.
Yeah, couldn't agree more with that. Emily, did you want to take over with the next question?
Sure. Thank you so much for those answers. So the next question is about what, if anything, has changed on the ground reporting on this pandemic this year compared to a year ago. And I'm particularly interested if you guys could talk about access to information, government data, what kinds of obstacles are you running into compared to last year, and or are there any benefits in terms of access to information this time around? Anybody who wants to answer first can just go ahead and jump in. Anu, please go ahead.
Yeah. So, last year when India, started reporting cases, it was quite, we had a very stringent lockdown for almost, 45 days. And then we started reporting cases. Ahmedabad was worse at that time also, and it is now also. But the difference is that, now this wave is quite scary. I during last lockdown and last, wave of pandemic, I used to go to hospitals. I used to go to the government secretariat to meet officers. I used to go to meet doctors in private clinics and other places for reporting, and but this time it's very difficult to, you feel scared. You feel scared because sheer size of, this sheer number of cases that are pouring in every day, and calls that you get every day that so and so died because of there was no oxygen in in the hospital, so and so died in the ambulance, because there was a huge queue for of ambulances carrying patients to be admitted in the hospital. So it's very, very scary, this wave, and that is why it's as I said, it's mentally quite exhausting.
Thank you. Anu, did you have something you wanted to add?
I was going to say, I think not much has changed in terms of government accountability, to the second part of your question, in terms of government accountability or getting more information or more data out. One of the first stories that I'd done last April was about a very small issue in the data, which was a recurring figure of 890 that was repeating in some of the government data. And this was before we had this amount of data. And of course, that amount, that little thing was not corrected. But I had been kind of tracking various data indiscretions for many months after that, and I just stopped after a while. In terms of getting an answer out of the government, either at the press conferences or we do our due diligence and we send emails, we followed up with phone calls. Nothing has changed really, and there's never been a mood to communicate, converse, to have more information out there in the interest of transparency at all.
Okay, thank you. We have some individual questions for each of you. Asa, do you want to go ahead?
I'll start by just asking a more of a newsroom question to Vikas, because you're someone who's not only reported on the situation, but you're also steering the coverage from the newsroom. So I'm wondering, what are the decisions that you're having to make on a day-to-day basis in terms of what news needs to be out there, what needs to be amplified, and how do you deal with those editorial pressures? Sorry, Vikas, I think you're going to have to unmute yourself again. I think Vikas is maybe having a tech issue, but while we wait for him to come back, I'll move on to Anu. Anu, you were saying a lot about the discrepancies that you find in data reporting. I think in India, there's a need for consumers to want to back up what they are hearing as, accounts on the ground with stats. So how are you going about ensuring that what you're finding is accurate, but also then explaining those discrepancies with verifying information from official sources to then what you're seeing through your own research?
We're making do with whatever data is available, and at India Spend, because we have so much of a data focus, the good thing is everybody's tracking data. For example, we track Parliament very closely. Somebody in the office would have made spreadsheets of information and data that's being presented in every Parliament session. So we know sort of where to go when we have to refer to these things. And this information really comes out in drips. So it's a matter of putting together a lot of this information and trying to make some sense of it. I do, however, feel like there is some futility because, even the best data analysis is still data analysis being done on very inferior data to begin with. So,
Right.
The conclusions that I'm going to come to are probably still off the mark, maybe very off the mark. But it's a sort of a nerdy maths game of, trying to catch the government on, how 2 + 2 didn't become 4, but it became 5. And at some level, it's very nerdy. But in the hope that the data that was first presented to us in the first place has any integrity, then the work that I do matters. But I guess I do what I do anyway, hoping that it'll stick at some point.
Yeah, absolutely. You talked a little bit about getting accountability through that data. What are the challenges that you're seeing there in terms of when you're asking for verification?
That there is no verification possible. I mean, sometimes when we are looking at data, we ourselves can see, or it feels very much to us that something is off. Some of the problems with the data sets from the government is that sometimes they're just not comparable. Like a bit of information would have been given in May 2020, and then we would never have heard anything else about it for a very long time. So you can't track a change. And typically, if you're looking at data and trying to do any kind of data journalism or data analysis, you're interested in change, you're interested in patterns, you're interested to see rise and fall. And it's very difficult when this data has not been given again or even given regularly. So yeah, it just it does kind of make my work difficult, maybe even meaningless, but yeah, still trying to work with whatever's available.
Yeah, I mean, I just want to step in and say it's definitely not meaningless, but I understand the frustration. I think we're still waiting on Vikas to join us again, but in the meantime, I'll move on to you, Mahesh. You've been on the ground in Gujarat, which we're fast seeing is turning into a COVID hotspot now. So can you talk about what the reporting challenges have been for you in a state like that?
Well, the main challenge is authenticity of the data that government gives out every day. It doesn't reflect the reality. The information that we get from the government every day in the health bulletin that is issued daily evening. So on the one hand, you see just 105 days across the state, and on the other hand, you see in the local dailies, local channels that crematoria are running out of roots. Hospitals, their morgues are full. People are being cremated on the pavements, and crematoria have set up another furnace to cremate bodies. Multiple bodies are being cremated on a single pyre. So it's first and foremost is data, and I'm very sorry to say that the data that is being given by the government doesn't reflect the reality on the ground. Secondly, it's there is also no mechanism that you can verify from any source, because it's very very tight control that the agencies have right now. So it's one way flow of information. You cannot verify because hardly anyone is answering phones. There is no one to take your queries. So it's just one side. Whatever they give, you have to report and rely on that.
Thank you, Mahesh. I want to. I think we're still waiting on Vikas. Oh, I think he's just joined us. Vikas, are you there?
I'm really sorry, I'm not having much luck
No,
with tech today.
That's fine. Yeah, now that you're back, would you like to? I don't know if you remember my question, but if you wanted to step in and answer now on what kind of decisions you're having to make as a newsroom.
Yeah, I was just beginning to answer. More than editorial decisions,
Okay, I think Vikas is still having technical difficulties, so perhaps we can move on to Suhasini, who reported a really moving piece on migrant trains that brought this disease to the far corners of India. While you were doing that, you were grappling with an outbreak of this disease within your family. I mean, how did you find balancing that? And then how did you go from an intensely personal situation that involved you so much in this pandemic to take a step back and try to be objective and try to just write this story without the bias that is natural and comes from being so closely and so personally affected by it?
So, when you're going in the field, and I was traveling all the while till March for stories this year, after the lockdown opened up last year. And while I was reporting on this story and doing like another day's job, I get a call saying that my father-in-law was like really sick. And all the while, all day you spent like just talking to doctors and people in the field who are losing their breath or, the symptoms. And you just kind of stop there in your tracks and you're like, what the hell, like this is happening at home in my family, and so you just jump on calls with doctors and you try to arrange a bed at a time. When second wave was on, there aren't any more beds, and it's like leading two lives at the same time, of a reporter and of a daughter-in-law and a wife and a mother. And it was tough. It was really tough. And you try to kind of be objective and not think about what's going on in your family, but they overlap. When you're seeing this guy, like kind of you're reporting on his wife telling you how he kind of lost his breath and he kind of collapsed on the staircase, and you're hearing news that your father-in-law is kind of getting breathless, you're like, what the hell? Like, where is this? Where do you kind of draw the line? So it is really tough. It's really difficult because you're actually living the whole trauma about the people that you're reporting on. So it's and you're just one person, right, doing two jobs. So you got to kind of figure out on how you kind of imbibe the other person's pain to make it productive in how you're dealing with pain at your own end in your own family. And for me, it was really helpful, to like work was like medicine for me when I saw my whole family struggle at the same time. When I got back home and I was trying to file the story, I was also juggling hospital beds for like everybody in my family, my husband, my son, my father-in-law, my mother-in-law. So it's really thin line, and you've got to kind of keep the reporter in you separated from the mother and the wife and the daughter-in-law that you are. But at the same time, you're living the same pain and the grief as that of your subject, of your interviewee. And as a journalist, it really helped me get over my pain to see what so many others were going through in their lives at that point in time.
Thank you. Okay, well, I think Vikas is still working, but can we ask a general question now for the whole panel? What role do you think civil society has played for reporting in the last few months, and particularly in the last few weeks? I'm thinking about the ways in which people in India and outside of India have used social media to convey all sorts of information, whether they're appeals for help or information about where supplies might be found. How are you all as journalists sort of using social media to help report the story?
Lockdown happened last year, and most of the big stories that he filed, like of this pregnant woman, who kind of ran from hospital to hospital over 8 hours and finally collapsed. It was all done basically on leads that I got on social media, reaching out to people, reaching out cases, where people were just dying without any hospital help at that point in time, and the numbers weren't even that high. So social media has been like the bane of my life, basically, and that's a prop that's kind of been around when I haven't been able to get out in the field, for instance, during the lockdown. So it's like a 24/7 cycle, and where you're getting leads, where, for instance, the story about how people are kind of now mobilizing to gather real time help on the ground versus governments which are like kind of failing in places like Delhi and UP. Social media has been like a huge reporting tool for me for the past 2.5 years.
Thanks, Sahasini. Does anybody else want to chime in on that?
Yeah. So, social media plays a very, very critical role during this pandemic. And this is where, I think without social media, we would be probably in darkness of information, because on the one hand, there is very tight control, from the government side to release the information. And on the other hand, if you don't have social media, it's for journalists, movement is quite restricted. It's very difficult to move around in hospitals and or crematoria, but it's thanks to social media, we get a lot of leads, we get a lot of information, we get a lot of video visuals that are floating around on WhatsApp or Twitter or other platforms. We get from sources, we get from strangers, we get from multiple people. So it's a big source of information, and it also kind of government doesn't it also it has become a platform to kind of put little pressure on the government. Government it seems that government doesn't bother about what appears in your morning newspaper. Government is more bothered about what's trending on the Twitter. Government is more bothered about what's happening on Facebook and what visuals are being shared by people on WhatsApp and other platforms.
Yeah, Mahesh, I think that's a really important point. And we've seen that in the last couple of days when the government asked Twitter to take down some posts that said we're critical of the government's response to the second wave. So it's been interesting in the last few weeks to just see how social media has become a really important tool of accountability. I think we do have Vikas now finally, so please, sir, explain your newsroom judgment strategy.
I too apologize again. It seems, the world didn't want me to talk about it. Every time I started speaking, it would disconnect. No, I'll just pick it. One of the biggest challenge for us is that a number of staff within the BBC newsroom are down with COVID. A couple of them we got into hospital with great difficulty. So it's again, managing the newsroom in terms of coverage, but also constantly looking after staff has been a huge challenge, not just for me, but other editors as well. For us at the BBC, the challenge is, how do we keep the story rolling, which is so fast paced? Things are changing, and I was hearing Mahesh talk about it. The biggest challenge is there is no data. We all know that there is underreporting. So it's just about every day trying to find, sources on the ground, look at social media. So we also did what a number of other publications have done, try to get data from cremation grounds. And at least if we can zero in on one or two cities, we were able to do in 3 different cities, in Allahabad, Varanasi, and Lucknow, a particular day, through footage and through speaking to photographers and getting some data from cremation grounds. We were able to prove that the deaths were massively underreported. So it's just about looking around and innovating what sources you can find. As we cannot deploy it. We do have teams on the ground. I have been out a couple of times, but it is becoming more and more scary because we do want to go out as journalists. We do want to tell the story because unless you are on the ground, it's very difficult to really know what's happening. But we all need to innovate. We need to find ways, and that way social media has been a huge help. I was just telling someone this morning, the most depressing thing on the planet at the moment is to just go on Indian Twitter. It's just constant cries for help, and I'm part of it. I'm constantly tweeting about people, friends who need beds, who need medicine. So it's been really hard on the newsroom. It's nothing like we've dealt with before.
Thank you. I think Manish has a question. Please go ahead.
Yeah. Well, first of all, great listening to all of you. Thank you for joining us. And my take on this pandemic is that this crisis, is a lot about science, technology, R&D. We talk about variants. We talk about vaccinations, vaccines, vital supplies, services. What have you all felt in terms of it as a challenge from a science and technology perspective? I mean, some of the reports and some of the data is so technical that you really have to be very up and informed and knowledgeable. And is that been a challenge? Greg, just
I
answer
can
any.
I can just take that question. I just joke around to my friends that I think it's time to start calling me Dr. Anu, because this is the second year of me not even reporting on healthcare but just reporting on COVID. So you may as well give me an honorary degree. It's been terribly difficult for me, but the point is, if it's difficult for someone like me who gets paid to understand these things and spends my day trying to understand these things, if it's difficult for me to understand it, then it's definitely going to be difficult for, let's say, my neighbor downstairs. So it's my responsibility to ensure that I'm able to communicate something to my neighbor downstairs. But it's complicated stuff. I think academics have, we've also seen through academics in this pandemic, because there is a sort of holiness that is placed on academics, that they sort of know what they're talking about much more than we as journalists do. But I think we've seen through, academics, whether it's from the science and medical fraternity or whether it's economists and modelers, there's problems with all of these disciplines, and I think that's come across quite clearly as well. So yes, it is technical, but as a journalist, I've also realized that my critical skills as a journalist is important, because I need to interrogate the science as well. And it's quite possible in this pandemic it's actually easy sometimes to interrogate it, because a lot of the science is shoddy. And subsequently, it is definitely my responsibility to communicate it this complicated stuff in a way that my neighbor downstairs can understand. So so it hasn't been easy, but there's a good reason to do it.
Thanks, Anu. I think we might now open the questions up to the audience, if that sounds okay with everyone. If you guys in the audience have a question, once again, please go on the Facebook page and write it in the comment section, and we'll get it here directly. The first question that we have is from Anirudh Prasad, and he's wondering, how difficult does it get for you to not get angry at a particular section of the media who maybe play a role in having a different kind of coverage? I can open it up to anyone who wants to answer that question.
And I think if I could interject, I think what Anirudh is asking is, do you get angry at journalists who seem to be parroting the government line?
I can take that. I think anger is the word. It's just not about the kind of coverage you see on some channels, but it's just anger all around. The kind of misleading statements we are seeing from politicians that beds are available, medicines are available, and the reality on the ground is completely different. You're hearing from your audiences, you're seeing it on social media. It does make us angry, and it is extremely difficult to stay neutral and still try to do your job. In short, yes, it does make me personally angry, and a lot of other journalists as well.
Can I?
Hasani, please unmute.
Sorry. What I was saying is that it is frustrating, to kind of watch a lot of the media kind of parroting and kind of towing the government line when, like for instance, what's happening in UP, for instance, now, and I've heard that Yogi has had a meeting with a dozen editors 2 days back and been briefed to say that, look, you cannot. You should kind of only put out positive news, So, and then, so all that you hear is like so many beds are available, as Vikas said, or so much of oxygen is available versus what the reality on the ground is, which is left to a handful of journalists who are like out there risking their lives and getting FIRs filed. Like UP's kind of been a leader in that, on filing FIRs against lone wolves, so to say, or independent journalists, who are working really hard in these back and beyond of places in UP. So it is really frustrating and infuriating to kind of see big media houses not stepping in while the burden of proof lies on the shoulders of those who are like ill-equipped and with no money and being pushed to a corner by a ferocious government.
Can I just quickly add to it? That's a very, very important point about our stringers and journalists who are reporting from the ground. I got a very distressing call a couple of days ago from a local reporter in Lucknow, and he had a family member sick, and he's been quite vocal about writing and questioning the government on different policies. And what he told me, he was particularly given a very hard time, a very, very hard time. He almost broke down that the only option for him left was to come to Delhi. So that just kind of tells you the kind of atmosphere we are operating in, especially in places like Lucknow.
Thank you. Yeah, please, Mahesh, go ahead.
So I'll agree with Swasini. It's very, very frustrating. On the one hand, you see all sorts of things on the ground, and then you have media, particularly TV channels, and showing that show some positive news. Why are you playing in the hands of those who have some agenda against the country, some agenda against the government, or some agenda against India? So it's very frustrating, and all at the same time it's funny also, because I think that they also have to do their job. Probably they don't enjoy freedom to. I don't think they will be doing it willingly. So I think that they have to protect their job, and their job is to kind of toe the government line always.
Thank you, Mahesh.
Sorry, go ahead.
Yeah, I mean, I just had a follow-up question to that, if that's okay. I mean, we've talked a lot about the topic of neutrality in these, and a lot of what you guys have said has loosely touched upon this. How do you sort of balance this pressure that we see sometimes, people asking about stories being neutral on an issue like the pandemic, where there's overwhelming evidence pointing to something?
So for me, the mantra is very simple. You just report on what you see, and that's it. It could kind of it could be anything. I mean, you just go on reporting what you're seeing, and that takes care of any kind of questions on objectivity or neutrality. Because as journalists, we're only supposed to be reporting on what we're seeing, whichever way it goes for whomsoever.
That's a fair answer, Sahasini, but I would push back a little bit on that, because a lot of us, as we've talked about, are reporting from home or reporting on the phones. We can't necessarily trust the data that we're being given from official sources. We're relying upon stringers or TV footage to fill out our reporting. So, I mean, it does become a little bit harder when we're not on the ground ourselves. So what kind of extra steps do you take to sort of verify information?
So for instance, I'll just give you an example with this latest story that we did on the undercounting of deaths. And Mahesh was kind of a precursor in the Indian media to have kind of reported that story out even before we had. And so we knew that, it was all there, not just in one state, but also like, thanks to other local reporters. And for instance, in Madhya Pradesh and Chhattisgarh and UP, that it was happening. So the basic premise is there, right? Like it's solid. Now, how do you go about kind of doing it by yourself while not being there in the field? And I'll give you a specific example of how I went about it. There's an auto rickshaw driver, like the most neutral guy that you can ever come across, whom I sent across these crematoriums in Ahmedabad with his mobile phone. And I asked him to knock on the doors of these clerks who do the, who write on these slips, sickness or bimari, as they say for COVID. And then I actually spoke to them on the phone to know what they had to say about that. So there are ways in which you kind of go around verifying things. If you cannot do it yourself, you rely on epidemiologists. If two epidemiologists tell you one thing and the third one something else, you talk to a few more. You kind of dig out the video and then you go back to the original source and then you ask somebody on the ground to kind of verify that. So it's like it's a tedious process, but you could kind of you get what you need from the ground even if you're not there.
Thanks, Hasini. I want to turn back to Mahesh and to Gujarat for a second. We have a question from fellow FCC Managing Committee member Sebastian Farsis, who says, talking about lack of transparency in Gujarat, for example, do you see a real intent to hide the truth about the infection numbers, the deaths, and if so, how? And are you seeing it play out differently this time compared to last year?
Well, yes, I would say that yes, the government doesn't want real numbers to come out. Maybe I had last year when they started doing it sometime in June. I had asked this question to several bureaucrats, and they told me at that time that if we reveal all the real numbers, then it will create a lot of unnecessary panic among people, and we don't want that to happen in the pandemic. So at that time, we thought that maybe 50 people are dying, and government is saying that only 35 or 40 are dying. So now this year, it's completely different. Now bureaucrats are saying that look, it's a pandemic. We are doing everything. Government is doing everything, but still government's all efforts are falling short against the sheer number of cases that are pouring in, sheer number of deaths that are taking place. So they have kind of concluded that there are preventable deaths and there are non-preventable deaths, and according to them, they are working to prevent those preventable deaths. So it's very this time, yes, it's very, very scary situation, because the number that we get from the government is just as per yesterday's number, Gujarat had 158 deaths across the state. But the real numbers that I got around 10 p.m. last night, it's very scary. It's very scary. It's it's almost 10 more than 15 times than what government is revealing.
Thank you.
Thanks, Mahesh. We have another question from Debashi Dasgupta. She asks, from a newsroom perspective, what additional support have your employers provided you that have enabled you to do, in whatever little way, the reporting that you're doing on the ground, especially during this difficult time? And I think it's a good question also in terms of what support you're providing each other as well. We can start with anyone who wants to jump in. Maybe Vikas, do you want to jump in? I think you'll have to unmute, Vikas, sorry.
Yeah. Can you hear me now? Can you hear me now?
Yes, we can hear you.
Okay. I mean, supporting each other is really crucial. There is a number of things that the organization I work for, the BBC, has done. We do have dedicated helpline for staff if they're feeling stressed that they can call. But it's more important about sticking to each other. And as an editor, it's been a daily routine to talk to everyone in the team, and not just about coverage, just about their well-being. So in my team, there are at least 2 people who are down with COVID and their entire families, one of them in hospital. And, each of us in whichever newsroom we work, it's very crucial to just call each other and try and not talk about the pandemic, try and talk about whatever else, give yourself that downtime. The other thing important is, because it's such a fast changing story, a lot of us have been just at it since it started without any break. We've been working constantly. So now I'm also trying to do, to ensure that people do get some downtime, not just the weekend, but maybe take another day off. So it's very important to switch off. It's much easier said than done. I have not been able to do it because you can cut away from work, but you can't really switch off your phone because, you don't know a friend or a family who may need you, whatever little you can do. But the bottom line is, we do need to talk to each other, and the kind of discussion we are having now is very important, where we forget about, we are working in different newsrooms, but just stick to each other, help each other, pick up the phone and talk and ask how you're doing.
Yeah, that's a really good point. I have to say, even in my personal professional circle, the only way we've been able to support each other is by having these conversations. So I couldn't agree more. Would any of the other panelists like to jump in?
I think foreign newsrooms typically do have a good setup. And I think a lot of these structures existed even before the pandemic. But I think people in Indian newsrooms, there's really nothing at all that we're offered. I'm currently spending about $10,000 a month on therapy. That's a lot, but I have to do it because, I mean, it's kind of like I'm subsidizing my job. Like I'm paying to be able to do my own job, because if I don't do this therapy that I need to do, I won't be able to actually, do my job. It's kind of keeping me functional as a professional. So I wish there was more support in, Indian news spaces. I wish it didn't feel like, like it still does feel like a stigma, in the sense, if I actually have a fever, of course, now if I have a fever, everybody will think it's COVID. But if I actually have a fever, I can always take a day off or take 3 days off or whatever. In the sense, nobody's happy about it, but I can ask for it. But it's not possible. At least I don't feel like I can ask for time off to just deal with my head. So it's difficult. And I have not heard of any Indian newsroom at all that has any affirmative policies to deal with this at all. In fact, last year I heard some shocking stuff from some Indian newsrooms. Editors, prominent editors, had written emails and messages to the newsroom, telling people this is the greatest story of your life, and you can't afford to miss it at all. And it's a young newsroom. Everybody's around 23, 22, 23, 24. It's their first job. They don't know about boundaries. They don't know about professional boundaries, personal boundaries. And when your newsroom creates an environment that makes you feel competitive in a life and death kind of a way, that's probably not healthy. And I don't think a young journalist is going to be able to take that on board in a sort of a reasonable perspective. It's going to be an extreme perspective. So in Indian newsrooms, I mean, I'm keen to hear more from the foreign correspondents here, actually. But as far as I know, I haven't heard of any Indian newsroom with any affirmative policy on this?
Well, I've
So,
really
yeah.
felt secure in the way my newspaper has been kind of handling this in terms of our security. Is also one big help has been like this elderly care benefit, and me being in Delhi and my parents being in Lucknow, especially after my father suffering like a really intense bout of COVID last year. A nurse basically like paying for like somebody who's there 24/7. That's been like a huge help for me, and apart from other things, it's been like really huge to have somebody paid by the company who's taking care of my parents. I couldn't have asked for more.
Yeah, Mahesh, maybe you can step in also and tell us, Anu said a little bit about the limitations of Indian newsrooms in providing support. Has that been your experience as well? And if so, how are you looking after yourself, especially when you're going on the ground to hospitals, crematoriums? How do you protect yourself?
Well, I will agree with Anu that it's a totally different in Indian newsroom, and I'm in a I'm a state correspondent for the Hindu, and I'm the only one covering entire Gujarat for the paper. So I'll just say that giving my personal example that I I didn't have a weekly off for last 1.5 months. Similarly, I didn't have a weekly off for 3 months last year during pandemic. So you can imagine. And secondly, forget about support. We do get a lot of support from our colleagues and people working with us. But since the way Indian media is structured in a way that it's we had salary cut last year, and I don't think our salary will be restored this year also. Original salary will be restored this year also. So you can imagine the situation that
Yeah.
we are in.
It's really
Yeah,
tough.
absolutely. I think one question that we have before we start to wrap up this discussion is around the rural coverage, which we're now starting to see a little bit of, but I'm curious to know from your perspectives, what are the challenges that we're going to see in capturing the situation in the more rural and hinterland areas of India? Vikas, maybe you can take that one up, because I know that BBC has a lot of language services.
I think that is the next big challenge. In fact, we had a big meeting today, and this was one of the focus that our coverage has been very Mumbai and Delhi and Lucknow centric, but things are getting bad in a lot of districts. We're hearing from in MP, in Gujarat, in UP, but we are not hearing as much as we should. So we do have a network, as you know. BBC broadcasts in about 7 languages from India, so we have state bureaus. And we are expecting to see a lot more coverage from those areas, but we are also kind of, beefing up our presence in other states by engaging more freelancers and stringers. So I think at least on the BBC tomorrow, you will see a lot more being reflected from remote corners of the country. But it is going to be incredibly hard, because if you look at, you can't really rely on regional media completely from these places, because a lot of the times what we have found that the reporting is biased, the data is not correct, we are not able to travel. So we really have to rely on stringers, but we also have to see who we are engaging, what's their background. So it's going to be the next big challenge, because Anu can talk more about it, from the modeling, we are seeing that it's going to get really intense in UP and Bengal in the next few weeks. And the big challenge we are going to face is, how do we get coverage? How do we get pictures? How do we get data from those states? So it's a challenge for all of us, not just for the BBC.
Yeah.
But yeah, we are slightly better placed because we broadcast in about 7-8 languages. So at least those states we are covered.
Yeah, I know. I might pass it on to you and see if you want to say something in response.
I think it's. I think we're going to have an additional issue. I mean, apart from the absolute lack of infrastructure to deal with something like this in a rural or even a semi-urban area, I think something to know in advance is that we are going to come up against a resistance when it comes to information and comprehension. So if not already, and I think in cities, it's difficult to explain to people that COVID is real, that it can affect you in X, Y, and Z ways, and that to protect yourself, you need to do A, B, and C. People are resistant, people are stubborn, and people don't want to believe it, maybe because it makes their life inconvenient, perhaps because it's an inconvenient truth, or simply because they're convinced of other things that have absolutely come to them on WhatsApp. So I think, this point that Mahesh made earlier on, that politicians are not so worried about what we as reporters might be saying on our newspapers. They're more worried about what's going on social media. Absolutely, because that social media tweet becomes a screenshot that lands in somebody's, WhatsApp in rural India, but Indian Express has not gone there. And definitely Indian Express in English has not gone there. So we're going to have, I think, a confounding situation of people not kind of knowing what's happening or not willing to accept that it's happening. And I think, at the bottom of the pyramid in India, there's a lot of, there's a sense of abandonment. I mean, they have been abandoned by the state forever. And so I think, here, when it happens in Delhi, there's so much of, politicians will want to politicize the situation. We want to make demands. The foreign media wants to cover it. But there is so much of distance between the state and its people when we're talking about rural India or semi-urban regions. So I think, at one level, there's going to be denial, there's going to be resistance to even believe that this is real, that this is happening. Politicians are going to obviously want to deny that it's happening as well. And so, all of these forces together will just come together and, create a mess in a situation where the health infrastructure also already does not exist. Like the physical elements needed don't exist. And then the non-physical elements, which is information, the right information, the resistance to that information, those elements will also come together.
Just talking about these elements that you just mentioned, Anu, in that case, Suhasini and Mahesh, I mean, you've often gone to the ground in rural areas to get these stories. What do you think, your approach will be in terms of reporting?
So I'll just give you an example from the last story that we did on the undercounting of deaths. And I was especially focusing on rural areas, like, for instance, in Bundelkhand and Mirzapur near Varanasi. And I'd reached out to these really small private doctors who said that, that there is a lot of underreporting because there's a social stigma and a sense of guilt that is attached to COVID, especially in like the rural belt where people are not literate. So they do not want news of anybody falling with fever getting out. And the next thing that they're asked to do, if they by chance come and report on the fever to this doctor, is go to like a public health center or the district health center, in fact, which is like a few kilometers away from their villages, to get an RT-PCR test done. So for instance, in Mirzapur, like the CMO, the chief medical officer of the district, said that 18 out of their 20 RT-PCR testing guys were sick. And he said that there are so many more deaths that must be happening in the rural areas, which will probably go underreported because they haven't got tested in the first place. So there are these challenges of, underreporting from the rural areas, which will happen. But as with the last lockdown and the last waves, we've consistently tried to reach, like, through local village heads or CMOs or stringers or, villagers, to see what's going on in the ground, to get as much of it out as possible. Like, it is really clear that I was getting the daily bulletin through a really small reporter, and he's like just this guy who's trying to kind of send out information to big media houses or whomsoever he can reach. And he was sending me these daily bulletins. I was talking to the CMO every day, and we're counting like 3 deaths on a day when their bulletin reads 0. So that's how we kind of also matched up, like, a big gap, in the death counts for that district. So there's definitely going to be a lot of underreporting, but we need to kind of, as reporters, like, just keep at reaching our sources and any and everybody to kind of see what's happening there. That's the only way to get the real story out.
Yeah, thank you, Suhasini. Mahesh, if you want to step in and give us your perspective.
Rural India, pandemic in rural India is the most underreported story as of now, because what is happening in I mean, we do know what's happening in Bombay, big cities like Bombay, Chennai, Bengaluru, Delhi, Ahmedabad, Surat, but we don't know what's happening in rural areas. And the messages that we get, it's a virus is sweeping in rural areas. We don't know what's happening. They don't have any, government doesn't have infrastructure to even test at taluka level. testing is done at district level. So villages are almost 100 kilometers from 20 to 100 kilometers away from the district headquarters. So it's a very big thing. I think next week I'm planning to visit few villages in Ahmedabad and to see for myself what's happening over there. But the reports that we get is horrible.
Well,
And then secondly, since social media is also primarily focused on urban centers, big cities like Delhi, Mumbai, Ahmedabad, Surat. So government is also not bothered much about what's happening in rural areas. Government is doing government government agencies have concentrated their efforts to see that big cities remain trouble free for them.
thank you, Mahesh. We're going to have to leave it there. We're just reaching the end of our time, but I think the consensus of the panel is certainly that we as journalists have a lot of work ahead, particularly in reporting information from rural areas where there's a vacuum of testing and information and attention and government accountability. So I just want to thank our panel for a wonderful discussion and thank our audience for being here. I'm sorry if we couldn't get to all of your questions. And a special thanks again to Asta for conceiving of the idea of this panel and for organizing it so well. Thank you, Asta.
Yeah, thanks, Emily. I wanted to once again thank our panelists. I know it's such a difficult time, so I so appreciate you being here and sharing your experiences. And obviously to Emily and Manish as well for putting FCC and its support behind this event. I just wanted to say one thing, which is that, I think journalists are working so hard to get the stories out there, and it's really important that we continue to support each other as much as we can. So if you can, seek mental health resources and seek out each other to try and get the work done. So thanks a lot.
Thank you. It was great to be here with everybody.
Well, let
Sorry.
me.
We'll
Thanks,
just let
Emily.
Manish.
Yeah, go ahead. No, that's fine. So let me first of all thank all of you. This has been a great, free, candid, frank discussion amongst us journalists about our experiences, individual and collective, about covering this devastating pandemic, and especially as it assumes a very bad proportion and sort of situation now in the second wave. But, it's thrown up a unique challenge to us in the media. We've never seen anything like this. We've never done anything like this, particularly as Mahesh and some of you pointed out, in the existence of social media, which has sort of come up equally, to media in today's circumstances. So that's a very important change that we have witnessed from the times of whether it was 9/11 or the Gulf Wars or Afghanistan or whatever other big serious events. And of course, one more important thing that has come up in our discussion today is that, like all other people, we are human beings as journalists. It affects us. There is an emotional, physical, psychological trauma that haunts us, and it does, affect us and our families equally. And I can only say on behalf of the Foreign Correspondents Club that we will try as best as possible to secure whatever help and support we can from our friends in the medical fraternity. So I'm opening it up to those, not just foreign correspondents, but also in the Indian media who feel that they don't want to or can't subsidize themselves. Great, Anu, that you're able to do it for yourself, but there are a lot of people who can't do it for themselves.
Yeah.
And if those people do need help, then we will try to make that available through FCC, through our friends in the medical community. Also, I do want to raise an important point is that we've all said that social media has played its role. Social media has been used by people also. So we do need to verify and ascertain our facts. I do hope that as we fight this pandemic together, whether it's government, people, or media, that more transparency sets in, that people are able to share honest, good information so that we can help meet the challenges of the pandemic one way or the other. And finally, we will come back with more friends like you and others who want to continue to discuss this subject, because this pandemic, at least for now is not going away. So let's stay vigilant, let's stay safe, let's stay well, And I'm so glad to hear that none of you or none of us actually has had COVID yet. So we have been fortunate, but we must make sure others don't do it, others don't get it. Please pass on the message. The one important thing I've noticed in India is people are not paying attention to vaccination, and they're still scared. They're telling me today, I mean, I'm talking about even staff members of FCC who are saying they don't want to go to get a vaccination shot because they're scared they might catch an infection. That's wrong. We do need to tell people you do need to get vaccinated. So I think as media, some of those things we will take up and propagate too. Thank you very much, and we'll close this broadcast now and look forward to seeing you all again. On a sad note, one of our very dear members, Anup Saxena, he's with German television, and I was talking to him earlier in the day to get his father a bed in the hospital. But as we were conducting this webinar, his father has passed away. So we do want to offer our condolences to Anup, and God bless. Thank you.
Thanks, everyone.